Since the beginning of the pandemic, Shelby Bay has been eager to lend a hand. The Cochrane, Alberta nurse works with the Red Cross and has been deployed all over Canada. She's now working at a COVID testing center close to home.
If me being at the testing center can relieve one less overtime call, then that's a win.
Bay is one of 13 Red Cross healthcare workers on active duty in Alberta. Outside resources coming in to help, just as some workers within the province are choosing to resign. On October 31st, all Alberta Health Services employees will be required to have 2 doses of the COVID-19 vaccine, and not everyone is willing to comply. AHS says that out of more than 108,000 workers, 92% have now submitted proof of vaccination. But there are 1,200 employees seeking an exemption to the vaccine mandate, either for medical or religious reasons. 61 workers have resigned because of the policy, including 31 clinical staff.
We stand by the policy, and it will be fully implemented. This vaccine requirement is essential to ensure the safety of our people, the patients, and vulnerable Albertans.
Last week, with concern mounting its mandatory policy could lead to healthcare shortages, Quebec pushed back its deadline. In Manitoba, there are 158 health workers on unpaid leave for refusing the vaccine. And across the country, legal challenges to similar policies are before courts and human rights commissions.
I think by and large, the mandates will stand, and that any successes we'll see will be one-off situations in particular cases where, as I say, an individual maybe doesn't get a health exemption that they should have received.
Of course, the major test will come as these deadlines pass. And in Alberta and BC, those deadlines are next week. Heather Yourex-West, Global News, Calgary.